All right. Hello and welcome to our public forum where we are going to review and outline community actions assessment and plan for 2026 and 2027. My name is Tim Hawkins and I'm the CEO of the Community Action Agency of Butte County. And this evening we're going to cover data we gathered for our needs assessment and then go over the services that CA intends to provide to address those needs. What we're looking for from attendees today is feedback on the plan. For example, do the results of the data gathered through the surveys and community listening session line up with your thoughts? This is a webinar format, so I ask that you pose any comments or questions through the Q&A section, which you can find at the bottom of your screen. And if I can address them during the presentation, I will. If not, we certainly will have time left at the end to address any remaining items. All right, let's get started. I'll share my screen. And all right. So to review our plan, and see the whole thing in a nutshell, you can go to butteca.com /community action plan /. It's a mouthful. All right. Our mission at Community Action is to improve the economic security and well-being of low-income residents of Butte County and our surrounding service area through diverse housing, human service programs, and community collaborations. We envision communities where all residents engage in creating and benefiting from opportunities to thrive, achieve, and enjoy life. Community action changes people's lives. It embodies the spirit of hope, improves communities, and makes America a better place to live. We care about the entire community, and we're dedicated to helping people help themselves and each other. So what is a community action plan? First, it starts out with a community needs assessment. This is where we're assessing any poverty-related needs. We're assessing using surveys, community forums, interviewing people, and then we take that data and we establish plans and goals and our priorities to deliver services. We develop local strategies to address local needs, and it provides us a 2-year roadmap. So we collected and analyzed data from the following sources: the Census Bureau, surveys, listening sessions, Butte 211, which has a treasure trove of data from everybody that calls asking for help, Feeding America, California Department of Health, and Butte County Public Health Department. All right, first of all, the poverty percentage in Butte County is 18.34, which is quite a bit higher than California at just about 12%, and then which is slightly lower than the United States at just over 12%. So clearly, we're having a rough go of it in Butte County. And then our poverty-related demographics, this just breaks it out into demographics. And a couple I want to highlight, the Native Hawaiian and Pacific Islander, which is in orange there, was pretty low and then took a steep climb about 3-4 years ago. Additionally, our Asian friends, which are in black, has remained in the top level. And then our African American neighbors started out at already pretty high, 37.1%. And then over the course of these several years has gone up 10% at 47.6. And here's a breakdown of our employment rates going clear back into the 1900s. And you can see where there was that long stint there where unemployment went up during the Great Recession and then steadily went back down. And then you can see that sharp spike with COVID, and then it went down fairly quickly after that, and it started to climb back up. All right, Butte County has a total population of almost 210,000 people, and our unemployment rate is 6.3, which is higher than both California at 5.5 and the national average at 4.4, and that's of January. And our median income is quite a bit lower, 68,500, compared to California's very high median income at 96,000, and then our national median income of 78.5. And, this is concerning because California, anywhere you are in California, is generally more expensive than most other states. And so, we'd certainly like to see this go up. And then a significant number of Butte County households, 18.55, earn less than 25,000 annually. And that's lower or higher than both the state and the national averages. And if you don't make 25,000 annually, we know you're in the hurt. If you do make more than that, really just try and put yourself in those folks' shoes and how difficult it is to make it by on 25,000 or less. So we did community surveys. We did this in partnership with the Butte Resilience Collaborative. It's a whole lot of local nonprofits that have formed a collaboration to just figure out ways that Butte County can be more resilient. It's headed up in part with the Red Cross, who played a big role in not only this, but the community listening sessions that we did. And we've been doing these surveys for quite some time, a little bit shorter than this survey, but this was the first year that food insecurity was the number one concern. And I just want to review a couple of the questions that came out in this. One was, I can easily access fresh and nutritious food in my community. And we certainly want to see people saying, I strongly agree, I agree. You really don't want to see somewhat agree, but that's okay, I guess. But that's just over 75%. So there's a solid 24% of people that don't feel like they can access fresh and nutritious food. And next one is, which best describes our household's food situation in the past 3 months? Of course, we want to see the enough of all kinds of food we want, enough, but not always the kinds of food, and then sometimes, but not enough to eat. That's borderline. So we have just under 75% of people that are feeling okay about the food situation in the past 3 months. But in the past 12 months, I've been concerned about having enough food for my household. What we don't want here is people saying, I strongly agree, I somewhat agree. And that's a solid over 50% of people are concerned about getting enough food. And then the second highest concern from the surveys was housing. And that excerpt questions are, my monthly housing costs, including rent, mortgage, and the insurance and all that, are affordable based on my income. And, strongly agree, somewhat agree. That's not quite 50%. And then it goes down from there. So clearly, over half the people that took this survey in our county are feeling like their monthly costs are unaffordable. My current housing situation is very unstable. We don't want to see the strongly agree, somewhat agree, but that's a solid 20, 25, 26% of folks feel like their housing is very unstable. And then the last question on our survey was an open-ended question, which asked people to, instead of selecting something, to actually write in their answers. That question was, what resources or programs or assistance is needed in our community or needs more support in our community, and please explain why. And there were 578 responses. We did review each of those, but we're using the tools that are now available to us. And we put those in AI. We use Notebook LM to put those in there. And it summarized those into top 4 themes. And if you want to see all of those 578 responses, those are in Appendix E of our plan. But to summarize, they said food assistance and then safe, secure, and affordable housing, and that includes homelessness, and then access to medical assistance and utility assistance were the biggest concerns. And then community listening sessions. We had 50 people participate, and a big shout out to the Red Cross team. They have a community adaptation team, which spearheaded these community listening sessions. They did them in Chico, South Orville, Magalia, and Gridley. Again, we reviewed the answers, but they summarized these and we put them into AI and asked it to categorize things into 5 themes. And again, you can see each of these detailed summaries in Appendix E of the document that's on our website. But those fell into economic hardship and financial strain, housing issues, health and healthcare access, social support systems, and environmental concerns. So I want to briefly discuss what the agency programs that we have that we plan to use to address these. So for food assistance, the North State Food Bank, it distributes food throughout Butte, Glenn, Colusa, Plumas, and Sierra counties. And we also have the 530 Food Rescue Coalition, which coordinates the diversion of edible food in the landfill from the landfill to feed people or animals. This is an app-based program. You can download it on your phone. It's called the 530 Food Rescue Coalition, and it sends you push notifications, and you can claim a rescue, and then it gives you kind of those Uber, Lyft type directions, where to go pick them up and where to drop it off at a nonprofit there where they will feed folks. All right, services that we have that will address safe and secure housing. We have our Esplanade House, which has 25 units of transitional housing geared toward families with children, homeless families with children. And it also has permanent housing for folks as well. We have a Butte Cares program, which provides housing, navigation, and financial assistance to help people struggling with homelessness get into housing. And then we have weatherization, which provides retrofitting to homes to make them safer and more energy efficient. A lot of times rentals, and this was something expressed in both the survey and the community forums, is some rentals will be, and homes that people own will be substandard homes sometimes and not safe. And so we can go in there and do carbon monoxide testing and replace dangerous things like ovens that may not be working correctly. All right, and then access to medical assistance. At our Esplanade House, for people that are there, we're in partnership with multiple nursing programs that provide on-site medical screening. We also have a drug and alcohol outpatient services, and that provides on-site evaluation assistance, education, and referrals. And then again, our Butte Cares, they provide enhanced care management, focusing on coordinating all aspects of members' care. It can get really complicated, right? Really stressful and busy. And some folks just don't have the capacity to coordinate all of that themselves. So our folks can come alongside folks and ensure they're getting the proper care they need and connect them with those services like medical, behavioral, and social needs. And then assistance with utility bills. So we provide utility assistance. Last year, we served just under 2,500 households with $2.3 million in utility assistance. And this can not only pay for folks' electrical or natural gas, but those who their primary heating source may be heating oil, wood, or wood pellets. We can help with that as well. And then we also have that home weatherization I was talking about. They go in, seal up the homes, find things they can do to make the home more energy efficient. That way, permanently driving down bills from those ever increasing electric bills we're getting. All right, that is the plan in a nutshell. Let's see if we have any Q&A. We do not. All right. Well, that sums up the plan. Again, you can go to Community Action's website and check out. I think it's open for another day or two, and you can comment on our website about the plan, and we will record those and make sure those get integrated into our plan. So I hope you have a wonderful evening. Take care, and thanks for coming out.